This is part of lecture on history taking and telephone discussion stations. You can attend and join these live lectures by joining this Telegram group. There is usually 1 to 2 lectures every week, and there is no registration required to join live lectures. You can also get more information by writing email on this email address. So today we'll discuss history taking stations, how are these stations organized, and how to perform well in these stations, and also telephone discussion stations. So history taking station, the this was the first slide. Actually, the history taking stations actually they assess two things. They're not only history taking. If you ask all the correct questions and reach to the diagnosis, everything is fine, but that there will be some marks that are only for communication skills. So you will not may not get that communication skill marks, because communication skill marks only assess your communication. They do not check the history taking station. So usually there is one examiner, sometimes there are two examiners, and sometimes one of examiner is lay examiner. He's not doctor. He does not know if you are reaching to diagnosis or question. He just feels like if you're listening to patient properly, how you are sitting, and are you empathizing with him? Like if say I had severe pain, you say, "Oh, I'm sorry to hear about that." If you're not doing that, then you do not get marks in communication skills. So in these stations, always there is a chance that one of examiner is a person who is not doctor. He's just sitting there that whether this doctor speaks well, is he good listener, does he empathizes, and use good right body language and his tone and attitude. So the these are the two things that are assessed in this. So you have to take good history and use communication skill. History we know, we'll discuss history, but what are the components of communication skills? These are some of components like active listening. Do not interrupt person and appear like you are listening to it. And active listening, then you nod your head when he's saying like you are understanding, you are with him, or you say right, yes, correct, yes, please continue, like this. So this is active listening. So you encourage him to speak and make him feel like you are listening to him, not looking at documents or writing notes. So that does not give good impression. You can do, I mean, the correct way is like this. When you can write notes sometime occasionally, but you should most of time be listening actively. Uh, Probably you do not write notes when person is talking. Use correct body language, like if you are empathizing it, you look like empathic. I'm feeling sorry, like that, not with saying sorry and you don't look like feeling sorry. So body language is good. Do not sit lean one side, sit equal side of bed, equal side of at the same level of patient. Usually in exam they have same level chairs. So don't lean forward towards patient like this and think. I mean, this is easy, but you have to think all these things. Keep in mind. And empathy. Empathy is patient. Oh, I've such a bad headache. I haven't slept for last 7 days. So your next question, if you say, oh, the headache is in front or on side, so that's not right approach. This not good communication. Say, I'm sorry to hear about that. This must have been bothering you a lot. Let's see how we can help you. So I'll ask you a few questions about it. Is that okay? Then is that okay? That makes the person you're asking him to taking his permission, not asking him question quickly. So finish 6 minutes. I have to know, is that okay? He said okay. Then this is good communication. This doesn't have anything to do with if you're writing, asking right questions or not. So addressing concerns. If person is feeling, oh my, I feel like I have cancer, so you can't ignore him saying, if in the middle of say he said, oh, I understand your concerns. Let me ask questions, then we'll discuss about it. Or you want me to discuss right away now? So, I mean, this way, if you ask at the end, it's fine, but the person during the interview will remain very nervous and upset. So, if we say no, they will have told him, do not interrupt them. So, most likely they will say at the end of examination, at the end of history taking. So, see the concern, why person is so worried. He's worried, he's asking you history, and he look worried. You look like very worried. May I know what's making you so worried? Like he may be having something in his hand and he's clenching that thing, and then you can't ignore that and ask him, and at the end, why you are doing like this? You look like quite worried. May I know why? What's the reason? So he may tell you something, and as soon you tell you, then you don't just listen, empathize. Oh, I'm sorry. We'll just address this. There are several ways to address different things in practice in UK and also in exams. Like if somebody wants to quit smoking, there are smoking clinics. If somebody has problem in home, he cannot cook himself, he cannot go for shopping, there are solutions for that. So everything in you can help him. So you ask them their concerns and use simple language. This is very important. Does the pain radiate? No. Does the pain, same pain you feel goes anywhere else? Uh, or do not use complex language. We'll see in history taking questions. Use simple language which person understand. Do not use over technical languages like we'll do DEXA scan, or we will do uh, will arrange some thyroglobulin antibodies and see what is happening with your thyroid. So it no sense for him. We'll do some tests to check if your thyroid is making some antibodies or chemicals like which are affecting your thyroid. If you use antibody, then ask him, do you know what's antibody? If he say yes, that's okay. If he say no, then explain him what's antibody in simple words again. So this is the use simple language and make sure they understand. Like you have given them 3 minute speech, and you can't just say they have understood. They might not have understood anything you have said, but as your doctor, you're speaking, they keep listening, and at the end, they don't understand anything. So one way of that is, can you please tell me what you understood? Can you please briefly tell me what you understood? This is more in communication skills, but in history taking skills, if you have time, at some points you can say, have you understood my question? Do you want me to explain further? Things like that. This is communication. Like if you feel like your patient is what you are speaking and he's not listening, he's looking here and there, then you ask him, is what I told you, is it clear to you? So this is these are the points which are checked in communication. We'll see this more in when we do communication skills station. So you do history and these things, both things. So everything has to be completed in 6 minutes. All aspects of history in 6 minutes. So you have to practice taking history in 6 minutes. That includes all aspects of history, introduction, then history of present illness, then differential diagnosis, past medical history, allergies, and you can actually do it in 6 minutes, but it needs practice. But in clinic or in bedside, you may spend 20 minutes. So in that way, you won't be able to complete this station. And then 3 minutes, you progress. 3 minutes, you present it. What is diagnosis? What is main diagnosis? What is your differential diagnosis? And then what investigations you will do. So this is in 3 minutes you explain to person and how you will manage. Sometime they may ask if there is time. So this is the how it is. So now let's see history taking. So history taking have some steps. There are some certain things you have to do before history, before you start person any question. These are must. So many of these may have some points in your exam. So you make sure you greet patient say by hello, hi, this is enough. Or good morning, hello, hi is enough actually there. Hello is okay as well. So then that's great. Then introduce yourself with your full name and role. I have explained it before. Your name, not full name. Your name is enough, and your role. You have to tell the name and role. So if after you somebody came, if they remember your name, they can tell that this doctor came earlier and he asked me. So also they know that you are doctor. If you go there and start asking them questions, they will not know that are you doctor, are you a some other hospital staff. So name and role. So hello, how example, hello, my name is Dr. This and I'm one of the general surgery doctor. Nowadays you can use term resident doctor or I'm registrar or I'm CT1 doctor. Whatever is written in there, they will give you instruction. You are doctor this, your name will be written, and then your designation. You are doctor this, CT2 in emergency room, and there is a patient. You will ask him history, who admitted with abdominal pain, so things like that. You tell him your designation because he know the surgeon has seen him. Otherwise, he will think it may be a ER doctor. So confirm patient's full name and date of birth. We have discussed, so will not because you want to keep their identity. Otherwise, you may take history from wrong person. May confirm your full name and age, please. You ask them full name. They tell you two names, that's fine. May confirm your full name and age, please. Not age, date of birth. In exam, you'll ask date of birth. Then you ask him verbal consent for asking question. I have been asked to ask you few questions about your condition. Is that okay? He said that's okay or that's fine. I mean, he has given you consent. The verbal consent inform purpose of interview. I have been asked to ask you few questions. Your GP has sent you with this complaint, and I will ask you few questions about it. Is that okay? It's not very vital, but it's important. If you ask, this will have good impression. In examination, it's very important. In history, it is good as well. You offer. Then offer a chaperone. Uh, if you're asking if you feel like person is young or their condition is like that, you offer them chaperone. In examination, you offer chaperone to everybody. Whatever examination you're doing, you offer chaperone in exams. If patient is in pain, offer analgesia. Like if person say, oh my God, I have severe pain in my knee and I can't move my knee. So you will not just say, okay, tell me what happened. You offer him pain. He say, no, it's fine. I can bring for you some pain. I can arrange a pain relief for you. Uh, or should we continue right moment? So in exam, they will say you continue because they know pain cannot be arranged. So offer analgesia before starting history. If person has severe headache, you offer to switch off or dim the lights. So this is important. There is any headache station, you offer them to switch the light because they say this light is bothering me a lot. I'm sorry, I will switch the light for this. But do appropriate empathy. Or you do not want to do over empathic. Oh, I will make a range and everything will be fine. Like no, you just in the adequate empathy. Start with, so when you start, this is the before start. When you start with open-ended question. How can I help you today? What brings you in today? You can use in your all two or three stations either one or one in one station and one in another station. How can I help you today is very good. What brings you in today is alternative. So they will start telling you. Then let patient explain initially uninterrupted. Then when they have finished, then you ask them about, then you start close-ending question and ask them additional question, and empathizing for listening chief complaints. So when they say, I'm having this terrible headache for last 3 months, I'm sorry to hear about this. Can you tell me more about it? Don't ask close-ended question here. What type, where the headache is more? Can you tell me more about it? Can you tell me more about it? These initial questions are like this. So now presenting complaints. So how you evaluate presenting complaints? So presenting complaint is whatever they say. I have abdominal pain, or I am having this red color urine. So any complaint you can assess by these complaints. Most of these you can assess by this mnemonic. When it started, uh, symptom, how long the symptom last, or how long this is happening, like onset, was it sudden or gradual? This is usually onset. Like I'm having pain since 6 hours. So how was it started? Did it start gradually or suddenly? So if gradual and sudden can differentiate, help you differentiate in differential diagnosis. Then duration can be months, hours, days, weeks. Then progression. How, if we say history of 4 months of passing blood in urine, how it has progressed over 4 months. Is it getting worse? Is it same? Is it intermittent? Is it continuous? So anything, even headache, whatever complaint you, is it getting better? Is it getting worse? Is it same? Then associated feature, headache. Do you feel dizziness? What else you feel with headache? Ask him this question. If he say no, nothing, then you ask, do you feel dizzy? Do you feel any weakness in your body? So well, it's important things you have to ask in close questions. Otherwise, let them speak. Then relieving factors and aggravating factors. Also, you can ask here, have you tried any medications? That's also part of it. Have you tried any medications? Have you seen any medical help? So that also tells you, they may tell you, I have done endoscopy, I have done this test like this. So this is presenting complaint, how you, after they are finished, uh, if these answers are not there, you ask these questions to make it clear. If it is pain, you can also, some of these you can use how it started and duration, progression thing, but there is specific for pain, because pain you want to know site and character and radiation. Other things are similar, because site, where is exactly pain located? Is it on one spot or widespread? So ask him, is it, where is the pain exactly located? Is it one spot or is it widespread? Then onset, gradual or sudden. Then character, is it dull, sharp, stabbing, throbbing, burning, or aching? How you feel like, can you tell me how the pain feels like? If we can't answer, then ask, is it like dull? Is it dull, sharp, stabbing, throbbing, burning, aching? So you ask them this. Then radiation, does pain go anywhere else? You see, does pain go anywhere else? You can exactly ask him this. Associate symptoms like nausea, vomiting, breathlessness. If abdominal pain, you will ask nausea, vomiting. If chest pain, you ask breathlessness, cough, or fever. Then timing, is the pain continuous or it comes and goes? And exacerbating and relieving factors. And S is severity. Severity, every pain, without asking site and radiation and severity, the pain history is not complete. These things you must ask, and obviously uh, character, but site, character, radiation, or severity. At least these four things you should ask, and you ask everybody on scale of. Just remember this and say this in exams. On scale of 0 to 10, how bad is pain? 0 is no pain, and 10 is worst pain you may have felt. So this is uh, in the pain. So if your complaint is pain, you go with Socrates. If it's not pain, dizziness, headache, or any hemoptysis, bleeding PR, you ask about this OD-para type of questions. So then, after you have evaluated this, you ask questions to rule out differentials. This is very important because if somebody comes with you with backache, purpose of asking these questions is you want to make sure is the backache mechanical, simple muscle sprain, strain, is it intervertebral disc prolapse, is this a cancer metastasis, is it a fracture, is it infection, is it a TB? So you want to ask this question. So this is how you make differential. So you ask questions to rule out cancer, serious conditions, infections, common conditions, and other conditions. We'll see how to do this. So you always rule out serious condition like backache. You don't feel like, oh, this backache is just like muscle sprain. So you take ibuprofen. No, you have to ask an exam. Have you noticed any weight loss? Have you noticed any swelling, lumps and bumps in your body? This means you are asking that he's ruling out cancer. So if have you recently had any trauma or if risk of osteoporosis? Is there any fracture? So you ask question about it. Then you ask past medical history. So this is presenting complaint and differential you have dealt. So in this, after up to asking these differential, you will have in your mind what is the main diagnosis and what is the differential diagnosis. So uh, so after that, you ask about his general health and other conditions, family history, drug history, and these are important because these are just not like simple questions to fill. Because past medical history, do you have any other medical problems? If they don't say, like, you can ask like diabetes or high blood pressure. Don't say hypertension. Many people know, but high blood pressure is the term which is used by. Do you have any surgical operations in past? If yes, they say yes. Did you have any problem with anesthetic or any other things? Which operation was that? Did you have any problems with anesthesia or surgery? So if no, then it's fine. But usually they don't have lot. Maximum they may say I have diabetes and I take metformin. But you have to ask both these questions. Then ask drug history. But drug history is not drug history of usually which drug history you have to have some things which you do not ask. Do you have taken regular medication and what doses? And any recent changes in dosage. This is important because person may have dizziness and you ask, you take this medication, this, and if you take any recent changes in dosage, yes, I take atenolol and they have increased it from 25 to 50 milligrams. So this might be the, so any recent changes in doses? And do you take any over the counter? This is very important. Asking about over the counter medications or any other herbal medication or supplements. You can ask like this if your station is like that because people can take, there are several drugs like cimetidine, omeprazole, paracetamol, ibuprofen. They can take over the counter themselves. They do not need prescription. So they may be taking this and that might tell us the diagnosis. So over the counter drugs and any drug allergies. Do you have any drug allergies? Very important because many people, they are quite good percentage of people will tell you they are allergic to this. If you don't ask allergies, if you reach to this part and you do not ask allergies, that's not good sign. Allergy, asking about allergy is must because he may have allergy to something and you may prescribe because you will be first doctor who will encounter this. Although the allergy is documented before, but in exam you must ask yourself, is there family history. Is there any illness runs in your family, or do other family members have same illness? Like, do other family members have same illness? Like, if somebody comes with breathlessness, you ask him, he maybe history of asthma or somebody else has same condition, and they. So these two questions. So social history is important. So when you ask sensitive questions, then you warn patient. You are asking about sensitive. Don't just go and ask, do you smoke? Do you drink? No. You ask, may I ask you some personal question? Is that okay? Is that okay if I ask you some personal questions? So he knows no something is. He will ask some questions, which he will be ready. So personal questions are actually about home, especially about smoking, alcohol, drugs use. So may I ask, so what is important? These all are important. Occupation, what you do for living. So his disease may be related to his occupation. Home situation, it's very important. You ask who you live with, because you give person anesthetic and they need to have somebody in home 24 hours. If you do a 10-day case and they say they live alone, so you can't do that. Then they have to stay in hospital. So everybody you ask this question, who you stay with in home. It's not like they will be living in home with two, three people. No, you have to ask them. Quite often they do not live. They will need some. They will tell you that they live alone, or you will need to do some special arrangement for them. So mobility, this is important, especially for older patient, older age patient. Do you have any difficulty in walking? Do you use any walking aid? It's very important, because if person will they be able to look after themselves, their life will be changed after surgical procedure and things like that, and in hospital as well. So asking about mobility is very important. So smoking, uh, do you smoke? If yes, how many cigarettes per day? So this smoking is important. If they say yes, then you have to say uh, how long you have been smoking, and have you ever tried quitting? Do you need help quitting smoking? There are several ways we can help you. So whenever somebody asks smoking, number of cigarettes per day and how many years they are smoking, and have they tried quitting? All these three are important. If they say they have not, uh, then ask him, do you need help quitting smoking? And immediately, or if they say no, thanks, I'm trying like this, or even if they say no, then you say there are several ways we can help you. So these are all important. You they say smoking, okay, you smoke 10 cigarettes a day and you're smoking for 5 years. No, you have to say, have you ever tried quitting? Do you need help in quitting? So if you don't ask this question in exam, this will affect your results. Like this is not good impression that somebody asking you smoking and you are not asking him to help. So alcohol, do you drink? How much per day? Have you considered quitting? Same like this, because many people, some people you will see they uh, actually you find them having drink. They if you find in exams or in your practice, then you need to give them some uh, vitamin preparations and things like that. But you need to quantify in your history. So all these are important things. So you have to uh, practice and do these things in short period of time. You can do actually in 6 minutes. So then ask about ICE ideas, concerns, and expectations. So at the end, you ask these question of ICE, what you think is cause of your symptoms? What are you more concerned about? Is concerned about system? I may have eaten something and my uh, digestion it has affected my tummy. So they think it's something food related. Our concerns, they say one of my family member had cancer, so I feel like I may have also. This is very important you ask him, because if you just do everything and you do not ask him, this, and you write the test for next 2 months, you'll be keep thinking. Then you have to tell them it's not possible to rule out entirely, but your symptoms are suggestive of this. We'll do these tests and try to find out the cause as soon as possible. And expectation, what you expect, hope us to do for you. This is E of ice. So you ask this, what you expect hope us to do for you. So uh, because person may come with severe headache and you do everything, I will do CT scan, I will say, I'm traveling after 2 days, I just want some pain medication for you and make sure there's nothing wrong. So sometimes it's helpful to us. So you ask all these, at least ask idea and concerns, especially concerns. But if you can ask three, all three are important. So you did differential at the end of respiratory. At the end, if you have time, you can do a system review. Try to do it. Like, do you have any cough or any chest pain? No. Do you get any breathlessness? Any ankle swelling? Three questions. Important thing. Do you have any problem with your waterworks? They say it waterworks, or any problem passing urine. Nowadays they understand passing urine, but that's a little bit more medical. You can use either one. I use passing urine, they understand, but you can use the term waterworks. Any indigestion, any vomiting, any constipation or diarrhea, any abdominal pain. If it's GIT, main complaint was GIT, abdominal pain, then you have asked most of these questions there, so you will not need GIT. Then you do remaining 4 system reviews, 3 system reviews. You can ask about CNS, headache, dizziness. So at the end, you thank the patient. Thank you very much for your questions. Now I will speak to my examiner and will arrange some, I will do examination. Thank you very much for your question. Now I'll speak to my examiner. This will waste your time if you say, we'll do blood test, because this is just exam station. But you can, if you have time, you can tell them, thank you very much for your questions. Now I will examine you and then arrange some blood tests for you. But otherwise, you can just stop, say, thanks for answering my questions. Now I will speak to my examiner. This is absolutely fine, because everybody knows that this is exam. So then exam, present your finding, like we'll do one example and then present our findings. Present your finding briefly, then you'll have 3 minutes for this. First, you present your finding. This is 60-year-old gentleman who come with abdominal pain. His pain started 3 days ago. Suddenly, it's an upper abdomen radiating to back, associated with vomiting. There is no, then important exercise, no hematemesis, no change in bowel habits, no recent weight loss. So this you are telling it is no cancer or things like that. And in past he is diabetic on metformin, and he is smoker and lives alone. As much few things you can in remaining thing you tell few things, because in this generally you have to make diagnosis and establish the differential diagnosis. But this one you tell importantly. Otherwise, to also tell he's smoker and like this, like upper abdominal pain, smoker is very important. And my first diagnosis is acute pancreatitis or acute cholecystitis or biliary colic, and my differential or acid peptide like this. Then he asks you what you will do next. After diagnosis, what you do next? First thing is I'll do physical examination, then I'll arrange some blood test, and then imaging. This and everything they ask you. So now we have this one station. We'll not discuss all history, because we know you'll ask Socrates, where is the site of pain, how it started, what is character of pain, radiation of pain, and aggravating factor, relieving factor. During this telling, you will find out many of questions. You will find out what's the cause of pain. But notice patient word. He say the pain gets worse when I move. So you have to tell examiner, pain gets worse when with movements. They say the pain is not there in the morning, but as soon as I start working in my shop, I move few objects. So you tell examiner same, the pain is not present in morning. It gets worse with activity related to his profession in shop. That's it. So differential diagnosis of backache. So first thing is intervertebral disc protrusion. So for every differential, you can't rule out differential just by Socrates. You have to ask special questions for each differential. IVD disc protrusion, do you have any weakness or numbness in your legs? You can ask in your legs. Actually, it can be higher, but most of disc cause numbness and weakness in legs. Any weakness or numbness in legs. So these two things, there are two questions. Caudate venous syndrome, any problem passing urine or bowel? This rules out caudate venous syndrome. Malignancy, any recent unintentional weight loss? Have you noticed any lumps and bumps in your body? For malignancy, these two questions are enough. So it means when you ask this question, the examiner will know that you are asking these questions because you are ruling out metastasis in vertebra. Ankylosing spondylitis, any stiffness, any problem in bending or moving right to left, turning your spine. Infection or TB, any fever, night sweats, feeling unwell. So these are the you rule out infection or TB. So you have to ask fever. Once you ask fever, he knows that the backache he's ruling out is not due to infection. Then mechanical back pain, trigger of how it gets worse, triggered by worsened by specific activities uh, or loads. So you have to rule all these things. You have to definitely rule out malignancy, infection, caudate venous syndrome. Because if you do not ask about caudate venous syndrome, it means you will miss caudate venous syndrome in hospitals, and uh, this will be not good for hospitals. So also, this is most common intervertebral disc protrusion. So this is common. This is first thing you will rule out. Then rule out infection and other things. Then there are some non-spinal causes of abdominal pain and also of backache, like abdominal aortic aneurysm, renal calculi, pancreatitis. So this depends on location of pain. You can ask one question: have you noticed any change in color of urine? Do you get any pain while passing urine? So these are the two questions you can ask about this. In pancreatitis, uh, yeah, pancreatitis is just in OD-para, and many of these you can ask, do you drink alcohol? And aortic aneurysm, you can't ask question. You ask past medical history. You can ask physical examination. I will look for abdominal aortic aneurysm. So you have to fit rule out most of these things. If you miss abdominal aortic, that's okay, fibromyalgia. But most of these things you have to ask questions about. When you ask history of presenting illness, OD-para, after that ask these questions. This is very important because most of your exam is concentrated on these differential questions. So then summarize findings. I would like to present Mr. Mrs. who was referred by her GP with complaint of backache for last 6 to 7 years that has worsened recently, last few months, as much as she said. Don't say recently, whatever she says, patient says. Pain is worsened by movements and change of posture. There are no features suggestive of caudate venous. Pain is worsened by movements and change of posture. This you are telling that's more with mechanical. Then you have to rule out serious condition. There are no features suggestive of caudate venous syndrome or malignant disease, malignant cause. She then in sociology, she works in office and is also carer for her son. She has diabetes and also diabetic neuropathy. Main diagnosis is mechanical back pain. I will also consider other causes. So this is your summary. Should take 1 minute. or less than 1 minute.